Good morning, good afternoon, and good evening. Welcome to the 421st day of continuous Zoom session of IFPH. Before we proceed, let us have a silent prayer for a minute. Thank you. Today, 26 October 2021, our guest is Dr. Dhanesh Jayasimhan, DHMS, member at Faculty Cell of IHK, convener of Animal Studies Circle, Kerala, having experience of 36 years. That's a great experience. We all know that he has a lot of potential. He just showed in the sessions by bringing a lot of persons from different walks of life and creating a new dimension to our IFPH. Very important and very crucial in the government decision in the last couple of days to promote homeopathy and allow the students to take homeopathic medicines to prevent the COVID during the initial session of schools. That much potential he has, he did prove. And today, his topic is memories, stories on lifestyle diseases, artistic persistence. On behalf of IFPH, I once again welcome you, Dr. Dhanesh. You can start now for the next 45 minutes. Over to you, Dr.
Thank you, Dr. Manoj. Good morning, good afternoon, and good evening to our friends in different parts of the world. I'm very happy to be back with another presentation for our webinar session tonight. And as you all know that the homeopathic immunobooster, that means the preventive for COVID-19 is giving in our schools from yesterday onwards. The 3 consecutive days, the medicine is given. As you know, the medicine is none other than arsenic alpha 30. So there are a lot of disputes going on there, and because the IMA, as you know, they came forward with negative comments, and they are against these things. But our government is firm in its decision, and so let me congratulate our government for taking such a beautiful decision. I must say, they save the children for the future. Because as you know, the homeopathy preventive is a very effective one, as people have observed all through all different people's different type of peoples from all walks of life have used this arsenic amalgam, and it found that more effective than the so-called injections they give. So I must say that in that words, because I'm not telling about the exact name of the process, so that is a different thing. So I don't want to be a person to be arrested for that. So the other people are also coming out with so those people who are criticizing homeopathy are supposed to be arrested in the future in that same line as we were forced to do, say, some things like that. Anyway, the Kerala government has taken a firm decision to give immune booster in the same way as the vaccination method. That means one need to register through a portal, and they have to fix the date for the collection of the medicine, and this is what happening. And now wonderful response from parents all over Kerala. And this is one of the thing that I must say, it is one of the revolution that happens in the history of Kerala homeopathy. And I think people from different parts of the world are looking at this, and because this is the so-called Kerala model in everything is one of the things that will be noted by people from different parts, and they definitely the study is in a research work way also. So definitely the results will come out soon, and that will definitely give another answer to our challenges. So let me conclude that line. Today's discussion is not on that. As you all know, I am here again, once again, back with the as a stopgap arrangement. So I have to say from my experience, as you know, today what I'm going to tell is something about the that I got the experience from treating some of the lifestyle cases. As you all know, we have different types of lifestyle diseases. One of the most important one is diabetes. Then second one is cardiac diseases, and third is cholesterolemia. Then rheumatoid arthritis, then depression, and like so many lifestyle problems are facing all over the world. But I want to give some stresses on hypercholesteremia. That is that all of us, all of you know that what is cholesterol. As you know, cholesterol is the substance which really gives the power to bind. The elasticity of the muscles is keeping. That is the main function of the cholesterol to maintain the elasticity of our muscles. So if you have a low cholesterol level, definitely your muscles will be in trouble. So in the early part of our sessions, in the early part of our century, I must say the cholesterol level was some 250 and is considered to be normal. But as there was medicine companies grows up, the level they reduced to then to 220, then 200, and now they are reducing it to 180, so that all the medicine they produce can be sold out in a short time. So that's the purpose of this cholesterol. There is nothing. I must say there is nothing in hypercholesterolemia. Usually, people say that the hypercholesterolemia may lead into heart attack and stroke like that. But frankly speaking, there are different. There is no evidence for that. But still, people are encouraging like that, saying that it is the cholesterol that kill. That is the biggest villain. But actually, it is not the case. So, but when we look for the causes of this cholesterol, usually people say that it is because of you are using lot of oils and a lot of food, the meat, non-vegetarian diet. That may be the reason. But frankly speaking, it is not the non-vegetarian diet alone, but there are many things that affect a person's increase amount of cholesterol. Of course, as a homeopath, we need to look in a different angle to everything. So that is the ability, that is the thing that we have to look into. As you all know that what we do in usually is just when a patient came to our clinic, usually people bring a lot of medical clinical reports. The doctor, I have so much, my cholesterol level is some 300 or 280 or something like that. I used to take this medicine or that medicine, but still it is not coming down. I am doing exercise, but still it is not coming down. Or now I was advised by so and so to take so much medicine, but after taking that so much medicine, I'm controlling it, but still when I stop this medicine, it goes up. So what can be the reason, doctor? What do you have any treatment for that? So this is the question we usually faces from different part of the patient, different type of patients usually. But frankly speaking, we have an answer to that. Actually, what we need to do is whether it is a hypercholesteremia or hypercreatinine, whatever be, then you need to take the case in detail. So you have to find what are the reasons that prompt the patient to have a high level of cholesterol level. So let me say a few things about that. Let me elaborate some cases so that you can understand how homeopathy works on such situations. For example, some 20 to 15 years back, I have a case for hypercholesterolemia in a patient who was just 37, remember, 37 kilos of weight. The most important, only just 37 kilos and not 137, it is only 37. The cholesterol level was more than and nearly 300. That usually she have 320 or some 280 in between like that. So when they visited me, I just find the thing. Then what are the reasons? What can be the reason for such a high level of cholesterol in that particular patient? When I inquired, what kind of food you take? Oh, doctor, I am down. I have gone to different type of treatment. In the early part of this hypercholesterolemia, I took medicines from allopathic doctors, but whenever I took that medicine, I got diarrhea, and so I couldn't continue that. And not only that, my weight is still like this, so I cannot tolerate that such a heavy medicine like that. So then I went to for Ayurvedic treatment, and where they gave some medicines also. But they asked me to continue with the vegetarian diet, and so I took vegetarian diet only. But still, there is no reduction. No, only nominal reduction in this cholesterol level, and not at the high level of cholesterol level reduction. So so then I stick on to naturopathy, where, as you know, they won't allow much food to eat. So what I do was only I took food only one time, once in a day, and that to millet like that type of food. But still, the cholesterol is not reducing. So this is a case where the food is not the villain and something else is there behind. So you have to remove the curtain and find out, you need to enter into the patient to find out what can be the cause here. Of absolutely 100% I say food is not the cause in this case. Then what can be the cause? That need to be, it is the duty of the physician to find out the cause of the illness. Yes. So I just started talking about her family life. She was a retired headmistress from a government school, and her husband is as a central government officer working. Both were retired recently, and then I asked her about her previous history. The history was that she was having acute bowel syndrome, ABS, or irritable bowel syndrome from the early part of her their marriage from the soon after her marriage, and so they took different type of medicine from different part of the world, particularly different doctors of different sectors of doctors, from allopathic, homeopathic, and even Ayurvedic doctors. But still, her diarrhea and this gastric diarrhea continues for a long time, and in between, like that was the history of her previous history of diseases. And the present history was same, but she is getting more lean and not able to do her things properly. And then I asked such a funny question: how is your relationship with your husband? I saw the expression of her face. It was dull. She was depressed. Then I asked, have you ever quarreled in between? Then she simply silently went, no, 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 like that. But I told her, only if you tell the real story, then only I can cure you. Otherwise, you may go out and you find some other medicine, or you may go for some other treatment, or you can go for some other expert like that. Then suddenly she told me, doctor, don't tell to anyone. I shall reveal my story. Okay. Then I asked, what, do you ever quarrel in between? And how will your reaction to that? Whether he used to scold you or not? Yes, doctor. He used to insult me from in all situation, in front of even in front of others. What is your reaction? No, I won't react to anything. I just simply sit down. I sat down. Then, what about the things in your bed? Whether you speak to him at the bedtime or not? No, doctor, I won't speak. Whether he will try to console you at night. No, doctor, he won't do. So then how such a solution is being solved? No, doctor, it may continue for some 2 weeks, or sometimes it may go to 28 days. Can you narrate a history of that? I asked a funny, then again a funny question. Yes, doctor. She then told me, doctors, some 40 years ago, that means about some 40 years ago, a mixie was one of the rare thing in a family. As you know, everybody used to do a mixie for making curries preparation, but this mixie is quite not a common thing in every family in those days. They brought a mixie, and while she has her first delivery, one fine Sunday, she was doing her kitchen work. She was using this mixie. Suddenly, the child called, cried, and she went there, and she took the child in her hand, and suddenly she tried to feed her. And in the meantime, she both went on to sleep. And after some time, this man came, and when he entered into this kitchen, he found that this mixie is not properly clean. It was just sitting ugly like that. What he did was he just entered into her bedroom and called, "Oh, you are sleeping. What at this noon? What a funny thing. Why are you sleeping like this? Why are you not cleaning this mixer? Do you know it's a precious one? Why can't you clean it now? Like that." So that was one of the things she was narrating, just like it happened yesterday. Just as well. So the thing was happened some 40 years ago back, but from the narration, what we felt is that she is narrating just like the thing happened just yesterday. So so that much of thing, that much of heart was there in her body, that in not in the body, in her mind. So she was so much insulted in that way. And he never asked why, but he simply criticized her. Then I asked whether he asked why you did that. No, he never asked me why. That is the problem. Then after taking this case, I found that it is because she is suppressing everything and not expressing things. That may be the reason for the for her diarrhea and all those illness. And so as you all know, the medicine, of course, it is none other than Staphysagria was the remedy, because suppressing everything and not expressing. When you express, when we need to express something, if you express that, definitely you will be in a better way, better healthy situation. Otherwise, you may go in a dull condition, and sometimes that may lead into a different disease condition. So that's the reason why she happened like that. And after taking that case, case, I give a dose of the same medicine and give and ask her to continue it for 2 weeks and come back to me after 2 weeks. And one thing I have heard is that just come, and on the second visit, she feel much better. And then on the second visit, I told her that next time you may please call me and inform me about your position, whether it is improving or not. Then you need not come, but you just send your husband so that I can reveal what I can say. Don't say, doctor, don't say like this to him, because he may make problem to me. Like that. Then I told her, don't worry, I can manage. I don't know. I know how to manage such person. I will simply tell everything in a smiling way. So don't nothing wrong will happen, like that. Uh, as expected, after 2 weeks, on the third visit, this person she informed me that, doctor, I am feeling better, much better, and so I'm telling, I am sending my husband, like that. Then suddenly, one fine morning, when I was in consulting some other patients, he rushed into my room and asked me, doctor, wife told me to collect the medicine from you. Then I told him, please wait for some time. I want
Some technical problems.
to speak to you. Okay.
Yes.
Then suddenly, as after that, then he came to the room, and then I asked him, do you remember when you buy the first mixie in your life? No, doctor, how can I remember, doctor, like that? What is the relevance of this such mixie? I have bought so many mixies in my life. So what is the relevance of the first mixies, doctor? Is I told her it was a precious one in that time. That's the reason why I asked you. But there are certain things that happens to you with your mixie. Do you remember or not? I don't know. No, doctor, I don't remember anything about the mixie story or anything. Then I simply told, how will you, how will you react to your wife? And said, no, we are having very good friendship, and we are living very in a happy way like that. Then I told, actually, it may be for you, it may be happy life, but to your husband, it may not. It is not like that. Then, doctor, why? Then I explained like this. Do you ever ask a question why things, why she does, she is not doing like this and she is doing like this, like that? No, doctor, I just, then why you make so much sharp criticism on her in front of others? No, no, no. I'm not doing that there. But frankly speaking, he is telling everything, but he is not remembering all these things. He's not thinking about the situation or like that. This is one of the things that we have to note. Some people usually simply say this and that, but they won't accept what they are doing. They won't be able to remember what they are doing also. Then I told the story about the Mixi story. And then I told him that it is when you can criticize or you can scold your wife, but on condition that before that you should inquire why you did not clean that like that. Not simply scolding is not a good time, but she, as you know, she is a mother. The mother's first duty is to care the baby, and everything, all other things are secondary to a mother. This is the point that you forget or you forgot. This is what I want to say. Actually, do you know what happened when she was using this mixie? Your child cried, and she, as a mother, know that the child may fell down from the. There are different reasons for that. Either the child may pass urine, or child may pass stool, or sometimes the child may have a bad dream and something like that, or sometimes the child may, and most probably the most important thing is child needs somebody support and the mother's breastfeed. As a mother, it is the primary duty of the mother is to give breastfeed to the child. So that is the reason why she just left this mixie in the kitchen unclean, and she went to care of the child. You must remember that the child is not only, the baby is not only for her, but you are also. So it is your duty to protect her. It is to support her in that situation, not scolding her. So that is the reason this kind of mistake you are continuing throughout your life, and that is the reason why she is suffering a lot. So if you are willing to, I am ready to cure your wife 100% if you give me 100% support. Then he told me, doctor, I am ready to do whatever things you want to do with me. I am ready to do. And this is and frankly speaking, with from the next week onwards, from the second time, and the fourth time she came, she was absolutely free from this cholesterol and everything. She was having very good sleep because of this kind of tension. She could not sleep properly. That was one of the reason for this hypercholesterolemia here, and the food has nothing to do. I just advise her to take one duck's egg in the morning along with the dosha or appam or chapati in the morning breakfast, and in the uh, uh, in the mid-meal, you can, at lunch, you can take fish curries, and at night also you should take for supper as early as possible with a simple diet. She was continuing, she was able to take all these things thereafter, and she's living in a happy way. So the food is not the villain here. So food may be a villain in some other part, that I will tell in another story also. I hope all of you enjoy that first part of the session, or the first story. Now let us go to the second case.
Okay, yes, yes, please.
The second case is a very recent one.
Yes.
And here, one of the patient, one of the person who is the son of my patient, who is having CA larynx. And once I started treating this his parent, he was very much interested in the way I different methodology by which I took the case. And one morning, he came alone to my clinic and told me, "Doctor, I have so many problems. I could not sleep for nowadays. I have a very high cholesterol level. I have hypertension. I'm taking this medicine, that medicine. I'm taking medicine for hypertension, medicine for this cholesterol, high cholesterol, then a medicine for sleep, like that. But still I am having not a problem. I cannot even move out because I feel palpitation whenever I try to move. I'm an artist, doctor. I used to work with, nowadays I can't even go for that. Then how, I asked, how long since now? Now for the last some 2 months back, I had COVID, and we took treatment for that from allopathy side, and thereafter I went. It took nearly 1 month to complete the course of the disease, and thereafter then I asked, why you are not going for that thereafter? No, doctor, I feel I feel lazy. I am feeling very tired, like that. Then I asked about her family, because his father, when his father came to consultation, he told me something like that, "Doctor, what are your worries?" Then he told me, "I have a problem. I am always worried about my son's family life." So I got a clue from that, but actually I don't know whether this person's case, or he has some other sons also. So who is the real person making trouble? But then I told him that there is a problem in your family as your father, because even though his father couldn't talk, but on the second visit only, he told me that, because he was able to speak in a better way after taking homeopathic medicine for CA larynx. And he was able to whisper something in a better way than the first visit. And so I got the clue that the patient's problem is not from that. Then I asked about his family life, doctor. Then to my surprise, he was a pleasant person. As you know, the artist, as his face was very bright in the beginning. But when I asked about the family life, suddenly the face changed. You can see the changes, just like that's happened with our some other organisms also. That will definitely give the clue how to enter into the patient. That is the time. Then you have to. Then the patient is under your control, or something like that. So then I waited. Asked, what about your family life, doctor? It's a pathetic. Then why? Doctor, then do you have any sexual problem? No, doctor, I am having a very powerful sexual organ, and I am having regular sex. Then what is the problem with you? Doctor, my wife is having some problem. Then I asked, what is the problem? Doctor, very recent, in the COVID time, some 1 year back, she went to her family, that is some 200 kilometers away from our house. And actually she didn't went to her house at all, but instead she went to her relatives home, where her ex-lover was living. He was an widow. He even though he married, he divorced his wife, and he seemed staying simply. And so she stayed there for 2 nights, 2 days, and then she went to her home and came back to our home. Then why you didn't know about all this thing? Yes, doctor, because she's talking every time, and she's telling that everything is going on fine. Then how you got these clues? How you got this, doctor? You from the YouTube I got it. I was surprised. What, from the YouTube? Yes, doctor. That fellow is his lover is a gunda like person. He's having so many affairs. And what he did was he took the video of this and uploaded it into the YouTube. And one of my friends saw the same, and he then directed me to see the same. And when I saw, I was quite surprised to see such a thing. I observed the things in very closely and find out what are the things that makes this person to go to her. Then he used to threaten her with this video. That was happening regularly, and that is one of the reason for the thing. But after knowing that, he questioned her, and she didn't agree first, but later he took this video and shown her, and then she agreed. She told first, she told that it is our video, like that it is you and me, like that. Then he told that you look at the surrounding, it is not our home, it is not our home, like that. Then she last agreed, and they were having lot of quarrels in between. But this man, as you know, is a very good person. He kept this thing sacred. But unfortunately, some of his friends see these things, and the news spread everywhere. And that then, yeah, as you know, this person was worried about his family, because his son is 15 years old, studying in 10th standard, and he is he is having a very high figure, like that. So what will be the situation if the child, his son, see all these things? That was the thing she was asking. He was worried. Then the second child is a girl. She was studying at 8th standard. So he want to divorce this person, but he cannot do that, because then if he divorce same, then the things will become news, and if the children saw this, then it will be terrific. So he didn't he didn't expose these things to different persons, but instead he reserved himself. But anyway, he didn't divorce. But during this COVID time, there was another thing happened. That was the thing. That was a miracle. That was one of the most terrible thing for him. There was a neighbor who was nearing more than 65 years of age. That person was in having an affair with this lady, and she gave a love letter to him. And he this husband got this love letter from the bedroom, and after checking, he was really shocked again, and they went to the advocate to file a case of common divorce. But he went visited so many doctors, including psychiatrists, with her, and they told that it is your mistake, man. You are not giving what the supposed to this lady is supposed to want it, like that. But actually, it is not like that. It is not his mistake. He is giving everything, but it is the mistake of because she has having such a, it is a disease problem, and he has nothing to do with that. Even though he was having regular sex, he was cooperative with in the bedroom, and she is enjoying also with him. But she is not satisfied in one person. That is the reason why she is running around all this thing, because from the early child, from the youthhood itself, she was able to have the sex with the other person. So she don't think that it is a wrong thing to have sex with another person like that. She has such a notion, and that was the thing that really makes him trouble. And because of these things, during this COVID time, this person went to have a feeling that if I go for work, she may go for someone else, like that. So I told him that it is not your mistake. She has some problem with, and that is the reason why you are having this disease. So we can at homeopathy we have medicine for you, and definitely that medicine will save you. So you can stop all your medicine within 1 week. And as the early as I told him that you immediately stop your medicine for cholesterol. You can reduce the pressure, hypertension medicine half. Then after 1 week, we can stop it. The same has done, and nothing has happened. From the very next day onwards, he started working, started to work home, to his job. He started moving. And now, with 2 weeks back, she came. He said that the doctor, everything goes smooth now, and I am feeling better now. I am not having any, so not much of pressure about this family life. So these are the things. Actually, he was only the only mistake he committed was that his supper was usually at 10 a.m. No, 10 p.m. That may be one of the reason, but actually that is not the reason at all. But I have advised, he was doing regular exercise for the last 1 year, that about one nearly 8 kilometers walk in the early morning, but still his cholesterol level is not reducing. So because these things really wasn't soon after, then after he was aware about her illicit relationship. So that was the reason for this thing, and that is the thing we need to look into. So this is the way a homeopathic doctor traces cases and find out the medicine, and once the medicine give the counseling to the patient rather than the doctor. If you started giving advices, definitely it won't work in some patients. Sometimes your advices may give some people relief, but not in 100%. But our medicine can work anywhere, to anyone, whether he is willing. The only thing is that he has to take the medicine in time. That is the only thing that I want to say at this case. And wow, I think Dr.
Yes,
Manus,
doctor. Yes, I think we can have a discussion, doctor.
okay.
Yes,
Oh,
everybody is listening for 2 cases, and you are also really talking
okay.
for the last 40 minutes. You
Oh,
are,
very good.
yes, you have lot of patients, another busy, busy schedules in your home as well as in the society. So it is right to continue this, I think.
Yes, sir. I
Yes,
have to go as the COVID preventive officer duty tomorrow.
yes, that's very,
But,
very. So I think we can have the discussion. Those who
yes,
are
yes.
interested to participate the discussion, please go to the participant list and raise your hands. Please. I think meanwhile, let me got a few lines from Hahnemann. What he describes about these conditions. In the chronic disease, he said that excessive hardships, laboring in swamps, great bodily injuries and wounds, excess of cold or heat, or even the unsatisfied hunger of poverty and its unwholesome foods, etc., are by not any means very powerful in causing the fearful malady of Sora, which lies in ambush lurking in secret to break forth into serious chronic diseases, nor of great consequences of an aggravating a chronic disease already present. Yeah. An innocent man with less injury to his life can pass 10 years in bodily torments in the basils or the galleys rather than pass months in all bodily comfort in an unhappy married life with a remorseful conscience. Yeah,
Exactly. This is what Dr. Hahnemann's observation. And if we really follow the Hahnemann in way, definitely there is an answer to anything and everything at homeopathy.
yes. Now, could anybody say that theory and practice are different? Never. It is. It is. What went wrong is the we interpreted wrongly. That is the
Both are,
problem.
yes,
Yes.
both are the
Yeah, yeah.
same side of the same coin. Both
Yes,
are the
the
two
last
sides of the
word,
same
the
coin.
last word is very interesting. We can pass some months in all bodily comfort in an unhappy marriage life with remote causes. It is
Which
more.
of which of origin, sir?
This is a chronic disease. Chronic
Oh,
disease.
okay. Chronic disease, chronic
Yes.
disease.
Very beautiful artistic work. We cannot satisfy. Even reading and reading, we must continue. That's a great poetry, no doubt about it. So everybody, please go to chronic disease. I think you can learn more. Now, Dr. Matthew is there. Please participate. Dr.
Okay.
Matthew, yes, yeah.
What was the remedy you gave, Dr. Dhanesh, for the second case?
In the second case, as you know, this was a sudden shock. That shock really took him away. So what
Okay.
then as you know, the medicine can be, one is the ignitia, the second can be natremur, then you can even think of staphysagria here also. But
Yeah.
frankly, I just give him carcinosin because, there is a different angle to this case because that there is a conflict going on in his mind. And that also carcinosin is an artistic, he's having an artistic ability here. And he's having this the things attends everything. He was having a very good relationship with her, and then suddenly things change after that, seeing such a shockful thing in his life.
Hmm.
So
Mhm.
that's the turning point. So in there, if then I have to give later more in the later part also. Even after carcinosin, I have to give
Okay.
to
Okay.
complete the homeopathic prescription.
Yeah. Suppose his wife was coming to you, what would be the remedy come up
Yes,
for
Yes,
very
her
good, very good
her
question.
issues?
yes. What can be your observation? What can be the medicine you are supposed to give to her?
Because it's a result of the childhood abuse.
Yes, exactly.
Or yeah. So that could be one reason that triggered all this problem in that poor lady's life. So we have to consider that first, and then there onwards we have to trace the
Frankly speaking,
yes,
that it is not a harassment, but it was a love affair. And that love affair that ends in a sexual
yes.
relationship, and she started enjoying that. So
Mhm.
we can think of a love failure here, but actually it is not the love failure, but it is the still the love is going on there. That is the reason. The craze for sex is there.
No, yeah, I understand. I see that, but she met her. She was in relationship with one of her relatives. That even though they said it was a love affair, I think this man was little older than this lady, and he seduced this younger girl at that time. Maybe we
Maybe,
don't
maybe,
know what
maybe.
time, what age, or maybe in her early teenage time
But
started. So it is an abuse. It's a seducing.
but the thing is that at the bedroom she is enjoying every part of the sex and everything
At
about
this
the sex.
time, at
But
this time, yes.
but uh, but the most the contrary thing that happened in is with the affair with this man who is 64 above 65. She has given a
Yeah,
love letter to her. So that
yeah.
point need to
Because
be looked into.
yeah, she became a nymphomaniac.
Not only panic, she want to have sex
Nympho.
with she just wrote in like the letter like that. I enjoyed that like that. I enjoy
Poor
the
lady,
time
poor
with
lady.
you. I enjoyed the time with you. That means that she has having some malicious
And,
activity in her mind.
mhm,
So you can
mhm.
think of her from album, then lacquers and all those things can be even platina. There may be difference, but there may be
Okay.
difference of opinion. Dr.
Anyway,
Manoj, what will be your
yeah,
I think
that
the
lady is also be treated. Yeah, anyway. Okay,
yes,
go
yes,
ahead.
Yes, that I told him that.
Sepia maybe some medicine, then the Candaris is another medicine.
Yes, yes,
Candaris
learning.
is another Candaris. Then I think acid floor is not a bad medicine.
Yes, 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 acid flow. Yes, acid floricum always have a this activity, sexual desire, immense desire, and they never satisfied with any particular person. That also is a very important point.
Okay, okay. Doctor. Thank you, Dr.
All
Nath.
right.
Thank
Now,
you, Dr.
Thank you, Dr. Dhanesh. Thank you.
okay.
Thank you.
If
It was
anybody
a
is
great
there to,
discussion.
anybody is there to participate in discussion, please raise your hand. Yes, yes, I think this is a very important point, and this Dr. Dhanesh mentioned. Our society is highly fragile recent days. We are always reading a lot of similar incidents, either from men or from women. Anyway, the always the victims are the children. They don't have father or mother. They were in fact becomes totally out of control. Definitely, we are leading for a social disaster, I think.
Yes,
Definitely. Yeah.
exactly. We are facing this thing. We are getting lot of cases
Yes.
on that variety.
Yes.
Uh,
Always these children, when they grown up, will be developed as an antisocial elements. Like it is.
Of course, that's the reason why we have seen some ladies even taking some men to with them, and they even cut into different pieces and dispatch
Yes.
them in somewhere. But, we are hearing about such stories that is happening with the highly educated persons.
Yes. This
Not
is
only
what is really happening, but nobody is bothering about this angle. Is in
yes,
fact
yes,
a lot of at least around 10%. I think there are a lot of problems in recent days. Only a few cases are reported due to some legal aspect reasons. That's fact.
yes, yes, that's the reason. So I have to treat such a case. That was a POXO case, and even the police persons came to me and asked about all the treatment history and all those things. They have to find the thing at my statement as a official document at the High Court, at the District Court, POXO Court.
Yes. I think the first case, I think the on more medicine is there. What about the role of this colosine first case?
Colossian, yes, Colossian is the same, but the difference is in this indignation. That means ailments from indignation. That is a different subject at all.
And I think if it causes more gastric complaints,
Yes, yes,
it may be. Then the related medicine, causticum, molosum, and staphylococcus. We all know the triopolyp NASH.
yes, yes.
Very important remedy. Yes.
Frankly, most of the people use colocin for only abdominal colic like that, but I thought really
In
the
fact, in
might of the
fact,
colocin.
in fact, Hahnemann once used colosine for giving was curing a Watts case of Watts. Yes, well, his student
Yes,
was very eager to learn about which medicine the doctor gave, and he very secretly opened the diary of Hahnemann and examined which medicine he is giving. He found it is colosine.
yes, yes.
So the so-called classical prescription was there at the time Hahnemann. This Hahnemann prescription, in fact, this Hahnemann prescription, once it was developed by Hahnemann, it followed by Ken, now it is followed by without cars. And now they christened as classical. But it is only homeopathy, not
Yes,
classical, homeopathy.
exactly. Everybody is saying that this is my school of homeopathy. Actually, all schools are under Dr. Hahnemann's school.
Yes.
That is a real fact. But things people want to propagate homeopathy through their name, and that's the reason. Frankly speaking, when I wrote an article that homeopathic medicine is the best counselor like that. But then once I go through on textbook, I found that such a thing was written by somebody else in the early part. But the thing is that I have never read such a thing. This is the problem with us. We are not reading regularly about the such books and so. Dr. Jacob Matthew is there.
Yes.
Dr. Jacob Matthew is there at UK, in the United States. I want to speak.
Yes, please unmute, doctor. You can
Please unmute and say some.
opinion.
Yeah, I'm here. After a long time, I'm here. Dhanesh,
Yes.
happy to see you. Dhanesh, Manoj, and all of us, all of you. So what should I say?
You can. Have you heard the great presentation?
Yeah, I heard. I'm listening there.
Any
Listening
comments?
everything.
Any comments? We are inviting your comments up now. Okay, right. What is your comment?
I guess you guys are too deep rooted. Deep rooted. That means you guys know everything, the minutest things. Manoj and Dhanesh. Okay, that's all. Continue.
Okay.
Thank
Now,
you.
Dr.
Thank you.
Matthew is there. Another person, Dr. Matthew from Georgia, I think. Isn't it, doctor?
Doctor is from.
Good.
Yeah.
I know Dr. Jacob Matthew from Kozhikode.
Yes.
Yes.
Good to see you, doctor. How are you?
See, good. Matthew
All
George, right?
Matthew Panekal, Matthew James.
Matthew oh
James.
my God.
Yeah.
I'm so sorry. Yes, I'm sorry.
I know. Now I know. You know me. Okay. I used to see you in IHK while you were in Kerala, in Calicut, with Ajit Kumar AG. He is in the group now.
Yeah. Ajit
How
Kumar.
are you doing over there? You may not know. Ajit Kumar, Jayakumar's cousin.
Ajit Kumar, AG Ajit Kumar.
Yes. You remember.
Yeah, he was my intern. I think so.
I see. Anyway.
AG or KG Ajit Kumar.
AG.
Ajit Kumar. AG Ajit Kumar. Yeah.
You know Jayakumar, right? Jayakumar and.
Yeah, I know Jayakumar. Yeah.
Yeah, right. Yeah, you are one of the colleagues. Okay. Anyway, glad to see you. How is everything in Connecticut? In Connecticut, you live in Connecticut.
Connecticut, almost close to New York.
New York, I know. I used to be in New York for a while. Anyway, glad to see you. All right.
Okay.
Go ahead with the meeting.
Continue, Dhanesh. Continue.
Yes. Thank you, doctor, for participating from distant part of the world and making this program as truly international. Thank you for. Dr. Dhanesh, I think another medicine is there, which is the colchicum. The words or misdeeds of others.
Yes. I was thinking about giving colchicum because he's an artist and he's so much.
Not causticum, but colchicum.
Colchicum is having the same problem.
The exact wording is words or misdeeds of others.
Yes.
Then another medicine is I think is revengeful. She's very much. He's still remembering the events even 40 years ago happened. Very revengeful. That may be the reason. She's always keeping that. Dr. Matthew Jayasimhan. Dr. Matthew, what is your opinion, doctor?
Yeah, I had a case similarly.
Yes.
There was a case of 40-year-old child abuse, and this lady came to my attention. For the care, she came with a severe depression, and just one course of Natromore reversed everything back to normal. Just Natromore was very helpful in that case. Only Natromore, and I gave her every day, daily dose of gelsemium, and it worked really good. Yeah, she was having severe problem because of the depression and because of that childhood history.
Yes, that is why we have the adaptability of medicine is very important. Sepia, so many medicines are adopted to the material often begins with. This is very important. Then another medicine is cocculus, romantic girls, bookworms, always reading is another one. Then there is another medicine is that there is a tendency to irresistible desire to sing. They're always keep singing. In the cocculus is also that medicine. There's an irresistible tendency to sing. So homeopathy
what is the medicine? Cocculus, you mean? Coculus?
Yes,
Yes,
yes.
I
Focus.
think Coculus. If my
Coculus.
memory is correct, it's Coculus.
Oh, Coculus is an excellent remedy for many years too.
Yes.
Many years. Coculus 200.
Yes, sir.
Many years. Yeah, I have good
Because we
results.
used to say that it is a very good remedy for this ear balance problem like that. I mean, that may be
Yeah.
why we used to scientifically we used to say it is a venous disease or peripheral
Yeah,
disease like that.
in the United States, it's a big business. $50,000 surgery for the veneers.
But soon after surgery, they may get the same.
It will come back again.
Yes,
It will come back.
then,
It's
After,
simply energy.
not only that will come back, the aggravate, as any man says, or the H.R. Robert says, surgery often activates psychotic asthma.
yes,
Mhm.
yes, exactly.
Then the stitch abscess is a manifestation of psychotic asthma. There are 3 or 4 chapters in H.R. Roberts, very interesting one. And also in Kent's philosophy on Sora's abilities and psychosis. We go through all these things, we can definitely get a more and more wonderful information from there.
If anyone want to make any presentation or want to talk, you please come forward.
Okay.
Dr. Sri Parit Bhavan, sir.
Sir, Farid, sir, please unmute yourself and you have an opinion. Yes,
Hello.
yes.
Thank you. Am I audible?
Yes, sir.
Sure.
I have been listening to the words of Dr. Dhanesh. His narratives was narrated beautifully and in a plain language. Everybody could understand the narratives. Anyhow, it is a complicated matter prevalent in our society nowadays. I'm very happy that Homeo has got remedy to rectify this. I'm very proud of this, of our doctors, family doctors. I think such a remedy measures are absent in other, especially the so-called modern medicine.
Yes, sir, sure. Yes.
That's why it's very, we should popularize this very, that means a very emotional thing is involved in this. So I congratulate Dr. Dhanesh for presenting all this without much preparation. He's thorough with all this because of practical experience. I have been listening to the writers. Thank you very much. All the best.
Thank you.
Thank you.
Thank you, Dr. Parit.
Come again.
Sri Parit Bhavan.
Yes. I think definitely we can have parallel systems for the Renaissance through homeopathy. New world order created by the other fellows. We just heard about the Melinda Bill Gates Foundation, the World Economic Forum, so many persons. We can suggest, just like the Linux technology, we can suggest a homeopathy renaissance. Otherwise,
Definitely.
nobody can escape from all these social problems. Stigmas are there. It will definitely leading to get tragedy for the world, I think.
Definitely.
The unrest is everyone there. Everyone is always there. Definitely, homeopathy is the lone option for those who always oppose us or in favor of homeopathy. They have to be come in that concern. The homeopathy means no other options, I think. But I think we can wind up.
Yes, sir.
I inviting Dr. Jacob Matthew to say a lot of thanks. Yes, doctor. Yeah.
Yes, Maharaj, what should I do?
Say a lot of thanks.
Maharaj,
Yeah.
vote of thanks from me.
Yes, of course.
Oh my God. I joined a little bit late. Okay.
No problem.
I joined a little bit late, maybe 10 minutes late. I would say not vote of thanks. Thanks from the whole homeopathy fraternity to Manoj and Dhanesh, and the inventor of this genuine movement, Shaji Kudiyat and Said Sir. Thanks to you all. Keep in touch. The one word I have to tell you that let us die or live. Die or live. We have to be united. We must be united, at least and in this moment. Okay? Thank you so much.
Thank you.
Thank you.
Well, that was the end of today's session. English session is over, and those who would like to participate can continue. And once again, it is the Malayalam session is starting, and I invite Dr. P.K. Ranji to start the Malayalam session. It's over to you, Dr. Ranji.